Okay, good morning. Committee will come to order. Welcome, everyone. Find a seat and make yourself comfortable. Couple of quick housekeeping reminders here this morning. We're going to try to get through these two bills. We are out of here at 9:25. We have to gavel in at 9:30 upstairs. So how long you talk on either bill is up to you. Potentially, if you talk too long on one, the other one might cry and scream as it fades away. So that's up to you all. That's number one. Number two is if you got cell phones with you, I'll ask you to turn them off this morning. I won't ask you to leave them on. If they do go off during testimony, you bring donuts to the next committee meeting. That being said, as very unusual in this committee, we're going to hear a very sensitive issue or issues this morning. I would ask for civility. I would ask for decorum. If decorum is broken, we invite those who break the decorum to depart the room, and I'd rather not do that. I try to be a nice guy when I can. So with that in mind, first bill on the agenda is Senate File 144, Chloe's Law, Children Gender Change Prohibition. Senator Bouchard, why don't you go down there for us?
Thank you, Mr. Chairman and members of the committee. Anthony Bouchard, Senate District 6. I present to you today Senate File 144, Chloe's Law, Children's Gender Prohibition. I guess I want to start out and let you know a little bit of background on Chloe. I mean, I came across her story and it really inspired me to stick to this issue and get on it, and let's get some work done in Wyoming. I'll just go a quick rundown on the bill. What we're doing in this bill is we're saying it's illegal in Wyoming, and simply I wanted to stay away from any kind of penalties, except for one thing, that if doctors perform it, they will lose their license in Wyoming. So that is in essence the penalty. It has definitions on page 3, healthcare provider. There's one little amendment we'll have to bring. There's something that was missed. So we have a cleanup amendment to make sure that is taken care of. But when we talk about the sterilization on page 4, the different operations, and you can see them on line 1 through 4 on page 4, performing mastectomies, administering or prescribing any of the following drugs: puberty suppression drugs, puberty blockers. The real issue at heart here is that children aren't ready to make these decisions. These are life-changing decisions. We don't even have real data on the reversibility. And it's almost like what's happening is we're experimenting and we're going to see. And that's a real problem. We're not saying here that people can't do this when they become 18. We're just trying to stay narrow here and make sure that children aren't being herded through a system. And as you're going to hear some testimony, how that happens, how some people in the medical profession have actually promoted, and I've seen even doctors. There's a doctor that actually calls herself Dr. Titus Deletus on social media and is targeting some of these young girls with social media. I mean, it's bizarre. We're missing the boat by not going to real therapy on underlying problems and trying to get children through those problems before getting a scalpel or drugs that are going to alter them. So that's what this bill is about. As we go on to page 5, there is a section on, there's an exclusion, and that's chromosomes and documented cases where there is a baby with maybe born with a deformity where they maybe have both sexes. That's excluded in the bill, so doctors can certainly perform procedures to correct those problems. The rest of the bill, 6 and 7, those are just pages 6 and 7 are basically the for violating. This is where you lose your license. So I mean, it's a pretty simple bill, straightforward. So I mean, I don't think I really have to dive too deep into it. And I'd rather just stand for any questions you may have on the bill.
Questions, committee? Seeing none, have a seat. You can have your regular
I
seat.
do want to add, Mr. Chairman, that
Go ahead and tell us about the amendment. That's
Yeah,
fine.
we distributed the amendment. What the amendment does is make sure that a advanced practitioner on a nurse side also has the same language in the bill. That's all it does, cleans it up. It somehow got missed in the drafting. So it's in front of you, so we can move it later.
Good catch by the Board of Nursing. Thank you.
Yeah, it was. I'm thankful they caught it. So thank you, Mr. Chairman.
Thank you very much. Okay. With that, do we have any agencies or departments who wish to testify to the bill? Director Johansson, welcome. Go ahead, sir.
Good morning, Mr. Chairman, members of the committee. Stephen Johansson, Director for the Wyoming Department of Health. I'll be very brief. On page 5, line 1 of the bill, as Senator Bouchard mentioned, there's a list of exemptions. There is a condition known as central precocious puberty, or CPP, that does happen. It occurs somewhat rarely. I believe it's 1 in 5,000 or 1 in 10,000 children might have this condition where puberty essentially starts quite early. Puberty blocking drugs can be used until the child reaches a normal pubescent age. And we feel like the intent of the bill is maybe not to exclude that, but I think it would benefit to be explicit with that condition, similar to the others that are mentioned on page 5. I am joined by Dr. Corey Cooper, who's a licensed pharmacist and oversees our Medicaid pharmacy program, should you have any questions about that. But Mr. Chairman, we would make that suggestion on page 5 and happy to stand for any questions.
Questions for Director Johansson, committee? Seeing none. Doctor? Oh, go ahead, Senator Barlow.
Mr. Chairman, so on page 4 of the bill, line 13, there's language that says in 12 and 13, puberty suppression or blocking prescription drugs to stop or delay normal puberty. Would CPP fall under normal puberty? Thank you, Mr. Chairman. And I'm not asking you as if I'm just asking in the general context. There are healthcare providers here, and there's probably others in the room. So I just want to know if that actually gets to this issue, and we can go to the sponsor, Mr. Chairman, at your will too. But I just want to know if that might fall under that. Thank you, Mr. Chairman.
Go ahead, Director.
Mr. Chairman, Senator Barlow, again, the way I read this and the reason for the suggestion is probably could work an interpretation in there to make sure it didn't apply, but I think the uncertainty could create similar uncertainty for providers or pharmacists. But I'll ask Dr. Cooper to speak to that if she has anything to add.
Dr. Cooper, anything to add to that? Go ahead and introduce yourself first, ma'am.
Mr. Chairman, members of the committee, my name is Corey Cooper. I'm a pharmacist and the pharmacy program manager for Wyoming Medicaid. And I think the term normal puberty just caused a little bit of heartburn for me as a pharmacist because CPP, while central precocious puberty, while being too early, earlier than we would expect, it is a normal puberty process. So the process of going through puberty is normal. It's just much earlier than what is standard or normal. And obviously for concerns of bone age and also the psychological implications of going through puberty at the age of 7, that's why puberty blockers are used for that condition.
Very good, thank you. Any further questions, committee? Anything further to add, Doctor? Nothing else? Oh, go ahead, Senator Bouchard.
Thank you, Mr. Chairman. Is there a simple, have you thought of any kind of language we could put a simple amendment in there just to take care of that without changing? I mean, obviously I want balance between how it's defined, and then come in and maybe put an exclusion in there for what you're talking about.
Director Johansson.
Mr. Chairman, Senator Bouchard, if I can answer that, I think anywhere on page 5, lines 1 through 7, so even at the end of line 7, and including central precocious puberty or CPP, would probably do it very simply.
Okay. Senator Bouchard wrote that down, so he'll remember that. Okay, very good. Okay, further questions, committee? Thank you very much. Any further agencies, departments wish to speak to this? Seeing none, let's start with in-room testimony first, and then we'll move on to, we'll do the online secondly. But let's do, if we can get a couple people up here at a time, it would be beneficial, so don't be shy, don't let the chair sit empty for too long. Let's get people up here. And we'll actually go from left to right, my left to your right, or you know what I mean. My left to my right. So go ahead and introduce yourself, ma'am, and go ahead.
Hello, Mr. Chairman and members of the committee. I am Mara McManaman, fourth generation Wyomingite from Torrington, Wyoming and Goshen County. I am also a 100% disabled Army veteran, but I am here as a private citizen. I am here in full support of this bill. As you all will hear today, the practice of changing gender on children is abhorrent. We need to do something about this gross injustice to our young people. Physicians and healthcare providers should be held accountable for these actions. We need to do something. We need to start somewhere, and this bill does just that. I am urging you all, please vote aye on this bill. Thank you, and I sit for questions.
Questions, committee? Welcome back to committee. We've seen you a couple times now. 3, 4,
Yes.
lots anyway. Welcome back. Always a
Thank you,
pleasure.
Mr. Chairman.
Thank you for making the trip. Okay, let's move on. Go ahead, ma'am. I understand this is your first time in committee. Take a deep breath and go ahead and introduce yourself first. Tell us your name and then go ahead with your testimony.
All right. My name is Luca Hine, and I'm here today not only as someone who has lived experience and has gone through the gender transition system as a minor, but as someone who has been harmed by it and is a victim by these practices. I was a young teenager with a history of mental health issues who had been groomed and preyed upon and exploited online. Yet the medical system did not address any of my underlying issues or why I had distress or why I felt the need to escape my body at such a young age. Instead, I was put down a path of permanent medicalization, one that I am trying to reverse, but I am unable to due to these practices being non-reversible. At 16, the very first medical intervention I ever had was a double mastectomy in the name of gender-affirming care. I only had one consultation with the surgeon and one with the gender clinic before I was allowed to do this. I was not able to fully give consent at the time due to both my age and my mental health issues. A few months later, I was then put on cross-sex hormones and started taking testosterone. At 21, I now live with lifelong complications from that I have no idea if they will go away. My joints constantly hurt. I have no idea if I will ever be able to carry a child someday. Not to mention the fact that my breasts are gone. There was nothing wrong with my body. I was just a teenager that was uncomfortable. And instead, I was pushed down a path that taught me that growing up was a disease that needed to be cured with surgery and medicine. Children deserve the ability to grow up whole. They cannot consent to being a lifelong medical patient. I sure know I could not. At 16, I did not understand what the long-term impacts of this care would be, if you could call it care. But the doctors were eager to push me down this path. To this day, the underlying issues I faced were never treated by these professionals. They were pushed to the side, all in the name of gender-affirming care. My parents were baited with the idea that I would kill myself if they didn't go along with it, despite the fact that I had always maintained I was never suicidal. They were told by the doctors, would you rather have a living son or a dead daughter? This is not the words of a medical professional, but the words of an activist. As more and more people like me are stepping forward as victims of this care system, we need to realize that children cannot consent to this. They deserve to grow up whole. and they deserve to grow up knowing that their body is not something that needs to be altered. Adults are different. They can maybe understand and they can do what they want. But children deserve to not only be protected, but given the ability to grow in a way that will not make them a lifelong patient. Thank you.
Thank you very much. We appreciate you did very well. We would have never known that was your first time testifying in committee. Question, Senator Dockstader.
You spent some time, do you recall who arranged these consultations and who decides, who puts that consultation together and then who makes the decision that it's all at one time? Do you recall any of that?
Go ahead.
My therapist did me to the gender clinic.
Thank you.
Further questions, committee? Senator Hutchins?
Thank you, Mr. Chair. I thank you for your bravery and your willingness to come and sit before us to tell us your story. It's a wonderful one, and it's one that I think many of us, I pray many of us here in this room are concerned about, most of all, protecting our children. So thank you for coming and delivering your story, and you did a wonderful job.
Thank you.
Very good. Think there's any more questions? Why don't you guys go ahead and have a seat and we'll rotate the chair and the mic. We'll go on, go ahead.
Good morning, Mr. Chairman, members of the committee, Sheila Bush with the Wyoming Medical Society. My comments this morning, I'll try to keep brief. We do oppose this bill, but it may not be for all the reasons that you think. Medicine is careful to take care of patients and they believe strongly in individualized care. I think what we have with this bill is a sad example of when politics overcomes good policy. Good policy would include a collaborative effort from our medical professionals in the state and our surrounding regional subspecialists who are delivering this care and trying to do so in the most careful, slow, and deliberate way possible. Our Wyoming physicians have repeatedly told this committee and others, these procedures are not being done in Wyoming. We are not giving surgery. I think the words mutilated were used. Some very sad and concerning words have been used around this topic. And your own physicians in the state have told you repeatedly, they are not doing this to children. I think you can find YouTube videos, you can find social media, you can find examples of individuals like this incredible person to my right who have been harmed in other states. Good policy might have looked like working together and crafting a bill that maybe outlined the procedures and surgeries. I think we could have gotten somewhere really good together when medicine is involved, when they're included, and when they're not demonized. They're not monsters. They're just not. The pediatrician in the district of a member of this committee came forward and gave very compelling evidence. I'm not crying, it's cold, sorry. Gave very compelling testimony that he's doing everything in his power to do right by kids. Medicine is learning. It will change. They are doing their very best. And with that, I would stand for questions.
Questions, committee? Senator Bouchard.
Thank you, Mr. Chairman. If they're not doing it, then why would you oppose the bill?
Mr.
Ms.
Chairman,
Bush?
I believe I was clear in saying that if we had worked together, we could have crafted legislation that would have been specific to procedures and surgeries, which is what they have testified they are not doing. What is being done in Wyoming in rare circumstances and with careful consideration are puberty blockers, sometimes to give kids more time. As was testified earlier, these puberty blockers have been used for a very long time. They have experience with them, they understand the risks, and it is in an effort to do right by each individual.
Further questions, committee? Seeing none? Senator Dockstader.
Similar to what I asked the other day, as you work with your physicians across the state, would you say this is unanimous on their part? Their decisions, they actually come together and discuss this? Thank you.
Go ahead, Sheila.
Mr. Chairman, Senator Dockstader, I represent close to 1,200 physicians. I've never seen them agree on anything unanimously. It's just not a reality of my world. The way our process works is our board represents every county in the state. Each elected member of that county come to the state board, and they bring the perspectives and positions of that county. When the Medical Society Board went through all of our bills for this session, there was not a dissenting vote on these policies. Yes.
And I would add to that, that you do have a letter in your packet from a physician that is a different opinion. So with that said, any further questions? Senator Hutchins.
Just a quick question about the Lupron. You said it's been used successfully. I know as in adult women, it's used sometimes before a hysterectomy. And I had a hysterectomy and I was put on Lupron and I developed joint issues. So I'm wondering with these little kids, are these below 18, have you noticed any joint problems, or have you guys talked about joint issues with these young adults? And then I think the young lady testified before that she has joint issues right now. And then another instance, last week, I believe, in testimony, a doctor said, if we don't let them do these practices on another bill similar to this one, he says we'll leave Wyoming. So somebody wants to do this. Thank you.
Mr.
Go ahead, Ms.
Chairman,
Bush.
Senator Hutchings, so a couple of things in there. With specific to a medication, I am not a physician. I regularly let you guys know I have a piano degree and a philosophy degree, but it's not a medical degree. And so I won't speak to specific medications. What I can say is that with every treatment, whether it's a prescription for a medication or a treatment, there's always a balancing of risk and benefit, always. And that conversation is an individual conversation, and it's a conversation that belongs between a care team and a family. I will also offer that if that's ever abused, as has been testified to, that's malpractice. We have existing law against medical professionals doing wrong by their patients. Your second question. That was it. Are you sure? I thought there was more there.
That was a very efficient answer.
Great. Look at me.
Senator Bouchard.
I just want to comment on the malpractice. I mean, we just had someone testify that would have to go through a whole lot of hardship to go down that road. So I think, wouldn't you agree we're just slowing this down here, and they could do this at 18? I mean, that's kind of what we're doing here. It's not, we're not trying to say we're going beyond the scope of, hey, we're going to shut this down forever. We're just trying to stop it so when children are developing. I mean, wouldn't you say just slowing the roll isn't such a bad thing?
Ms. Bush.
Mr. Chairman, my testimony was exactly that physicians are trying to slow things. We just have different ideas about what that looks like. The testimony earlier is a very sad story, and I'll repeat, it's not a Wyoming story. It's the procedures and surgeries are not the recommended care. They are not the standard of practice. They are not being done in this state. And so that, again, if that's what this conversation was about, would look a lot different. It's not what this conversation is about. It's about all of what medicine is trying to do to learn and grow to care for these individuals in the best way possible. And this one does go too far.
One follow-up question.
One follow-up, Mr. Chairman. I heard a doctor had testimony that she loved blood loss. That wasn't very compelling to your story. And to talk about this case that was in front of us this morning, it was in Nebraska. It was in a neighboring state. So it's not that far away. And hearing the doctor saying they'll leave this state doesn't convince me that there aren't people that want to go the route that Nebraska's doing. So I just want to say that. I mean, if you want to add something, or I mean, it is kind of local to us. Wouldn't you agree that Nebraska is not that far away?
You can respond if you wish, Ms. Bush.
Mr. Chairman, I'm aware that Nebraska is a neighboring state. Thank you. I would say I got really distracted with not knowing Nebraska was next door. Um, it's local. Our physicians aren't doing this. They are slowing the process. In Wyoming, they are referred to subspecialists outside of state. Often, our patients are waiting on wait lists for up to 3 years. Through that 3-year process, or sometimes 4 years, they have to comply with a number of things with mental health and counseling and therapy. It's not quick. It's not, we had 2 visits and I had major surgery. If this bill were about procedures and surgery, we would be having a different conversation.
Make it a question if you would, and make it quick.
So, Mr. Chairman, you just said that they're going out of state to do procedures. My concern is a repeat of what we just heard, because that doctor isn't on the same page as what the page that I'm on. That doctor will still perform procedures in our neighboring state. So I think the sideboards we need to put up are a lot tighter than the ones you're talking about. So, I mean, wouldn't you agree that a patient could actually go through the same thing again? Because we're not, without this bill, somebody who maybe disagrees with us could actually say, well, I'm gonna put somebody through the same thing that you just heard this morning. Because I don't see anything that says that we're slowing down, we're trying to slow it down. Where am I seeing that in writing? Where am I seeing that in testimony other than you? Other doctors said they would leave the state. So I want to know where those sideboards really are.
Respond as you will, but know that we have to move on to other testimony. We may hear some of that from other testimony, but go ahead, Ms. Bush.
Mr. Chairman, many policies being discussed this session are having a very chilling effect on medicine in the state. We have multiple medical students and residents saying, I won't come back here and practice if they want to make me a criminal for trying to do the best that I can and use the training that I've gotten. Those are real words. Those are true sentiments. I do feel compelled to quickly give some context around the comment, because it's been repeated so often from a physician of ours about blood loss. Physician humor is lost on many. It's taken me 17 years to really understand some of their humor. The intent of that comment was to say, as a surgeon, as someone who was wired to enjoy surgery, I don't recommend this. Her point was, of all the people who would come to you and say, yeah, let's do surgery, she would be eager to go to surgery because she enjoys that process. She enjoys healing in that way. And it's a very necessary component of healing. Her point was, I'm good at it. I was wired to do it. And I don't think this is a good idea. When taken out of context, it sounds alarming. When put in context, it's making exactly the point that you all are also making. And I think we have to be careful to not weaponize words of our own people in the state. Maybe it was an ill-timed joke. Okay. But she wasn't making any more of it than that.
Okay, let's go ahead and move on. Go ahead, ma'am. Introduce yourself. I think we recognize you, but introduce yourself anyway.
Thank you, Mr. Chair. Thank you, committee. My name is Sarah Burlingame, and I'm the Executive Director of Wyoming Equality, and we are in opposition to this bill. So I've been in my position for the last 7 years, and as the director of a statewide LGBTQ advocacy, we field a lot of phone calls from parents of transgender children. And in the last 7 years, I have never received one phone call, email, or text saying that they needed surgery for their minor child. It just hasn't happened. We have received hundreds of text, Facebook messages, emails saying, how can I best support my child? And we also run a support group for the parents of transgender children. And for a year or two, I got to facilitate that. And I wish everybody on this committee had the opportunity to listen to those parents and hear their concerns for their children. Not only were none of them centered around surgery, but they were incredibly mundane. They were the things that everybody worries about for their children. They really worried about them fitting in. They worried about their interactions with their peers. They worried about locker rooms. They worried about bathrooms. They worried about lunchtime and recess. They worried about all the things that all parents in Wyoming worry about and want for their children. They had the added wrinkle of also worrying about their child's gender presentation. And it really ran the gamut. Some of these kids went into kindergarten in Wyoming schools presenting as the gender opposite from the sex that they were assigned, and were immediately brought in by their teachers, by their peers, and had great experiences. That's not the word I'm looking for, but it's gone. And others had really tragic and wretched, experiences. And so facilitating this group for parents of transgender kids, we talked about all of those. And that is a thoughtful process. And that is one that I think isn't entertained, unfortunately, in bills like these. The other process that I think reflects Wyoming's best efforts was the Wyoming Medical Society had a conference this last summer, and it was an opportunity to talk about gender-affirming care. And there were two parts of the conference. The first part was clinical, which I can't really speak to because I don't even have a degree in piano when it comes to medical things. But the second part was about policy. And the conversation that we had there encompassed people from people who thought that no kind of gender-affirming care should ever be acceptable to minors, to people who made it their life's work to offer gender-affirming care. And what we had was a thoughtful conversation. What we had was something where we didn't demonize each other. We didn't assume that someone was trying to harm children and someone was their salvation. Instead, it was a conversation that recognized that these are real Wyoming families. They are struggling to understand how to best serve the needs of their children. And if we have a place where those conversations can happen, and if we have bills where the medical community is brought in and we say, hey, we think that things that happened in Nebraska are terrible, are a tragedy. How can we make sure they never happen in Wyoming? We stand ready to support any legislation that would give us that process, that would give us those outcomes. But this is not that, and we would really ask you to reject this proposal for what it is. And I'm happy to stand for any questions.
Thank you, Ms. Burlingham. Questions, committee? Seeing none. Thank you for
Thank
coming.
you, Mr. Chairman.
Let's move to the other end of the table.
Mr. Chairman, Bill Winnie, Sublette County. I have some experience during my time on active duty in the Navy that may shed some light on the needle you're trying to thread. The Navy and other armed forces have alcoholism programs. And I saw one young man drawn into it labeled a, quote, dry alcoholic, unquote. I thought that odd. I let the process work its way through, talked to the young man a few times. At the end of the process, it goes about a year or so, I finally concluded that he had been drawn in. He never really had a problem. And so that's kind of what you're trying to figure out here is how do you get from those who might be drawn in. Some 2 or 3 decades ago, this nation went through a period of hysteria where child care centers were accused, the adults at child care centers were accused of demonic and depraved activity with children. It finally ran its course. And they finally concluded that it was projection by some other adults. So you're trying to thread a needle here between those very, very few children who might truly be at issue and those who could be drawn into irreversible actions. Subject to your questions. Thank you.
Questions for Mr. Winnie? Seeing none. Go ahead. We got 2 empty seats for anybody else that's going to come up. Please come join the seats. Go ahead, sir.
Thank you, Mr. Chair, members of the committee. My name is Tyler Sesser. I come to you as a concerned parent, as the husband of a breast cancer survivor, and as a friend to people with developmental disabilities that I've grown up around and heard kind of stories that this bill might affect them as well. So as a parent right now, I'm looking forward to the future my daughter might have, and the options that are there for her. And I'm hoping that there's growth in the medicines available so that we see less side effects. I'm really hopeful that we can see that. And I'm proud that we have a process that we can engage in that it's not outright outlawed so that we can't explore and figure out how to do this work better. My concern, but also my gratitude to Senator Bouchard about your willingness to explore the amendment for the exemption for the puberty blocker at the early age. That's kind of where my concern is now. I think there's more exemptions that we need to consider. I think they've been brought up by other speakers. The one that comes to mind for me is a lot of parents of children with developmental disabilities rely in part on puberty blockers and hormone therapies to extend the body change process and to kind of provide them some time to navigate that. They also rely on some for the prevention of unwanted pregnancies in teenagers with developmental disabilities. This bill, I think with a similar concern that we heard earlier this morning, might create fear amongst providers and fear amongst parents of how to navigate that. But just as gender transition and gender affirming care is a complex conversation, so is that. There are a lot of people with developmental disabilities who talk about self-advocacy and bodily autonomy, and we're exploring that within that community. But that conversation with this bill is halted and said that exploration is illegal and will prevent them from having access to those medications that improve their quality of life. For my wife, as a survivor of breast cancer, she was diagnosed early, and we've been together. In March, we've been together longer in life than we weren't. So it'll be 18 years together. But she was diagnosed early on with the BRCA2 gene. And later in life, after she turned 18, she had access to tamoxifen and medication that reduced estrogen. But what happens if my daughter gets diagnosed and maybe there's an advancement in medication that could prevent her from having breast cancer later in life, and that hormone therapy is seen to be effective within teenagers? Will this bill prevent my daughter from accessing the care that she doesn't have to go through what her mother had to go through? So with that, I'll stand for questions. I feel like these amendments are too great for us to accomplish today. I encourage you to vote no on this bill. Thank you.
First of all, congratulations on 18 years. That's very cool.
Thanks, sir.
Questions, committee? Senator Bouchard.
Thank you, Mr. Chairman. So this bill is geared for one thing. It's not for other treatments, other hormone treatments. I mean, have you read the bill? It's very specific. And back to the puberty blockers, there are some drugs that are being used for the same, for puberty blocking, that they really they don't know the long-term effects. And so some of that experimentation is detrimental. So you do understand that so two questions. One, you do understand that this bill only affects one procedure that with sex change and to minors. And the other thing with puberty blockers there are a lot of experimentations going on. This bill is not going to affect that, but also understand there are dangers. And do you understand that?
Go ahead,
Mr.
sir.
Chair. Thank you, Mr. Chair, Senator Bouchard. So under subsection B, Romanet number 3, I believe that some of that language and elsewhere in the bill creates reasonable concern and fear that this would apply to that medication. As someone who's worked with the developmental disability community for close to 2 decades, that I can share that I think this will cause concern in whether or not the parents will be criminalized Children with developmental disabilities also have sexual orientation and gender identity, so this might affect them in a way that we are not aware of yet. And to your second question, I'm acutely aware of, as I said, my wife went through and was on tamoxifen, and we've lived that life. But what I do know is that because of her experience, there were great benefits to the medication that she took, and there's been great advancements since the time that she started taking those. If this bill passes, it prevents any future advancements because we cannot explore the efficacy of these medications. I'm not a clinical person. I also have a music degree. I'm a saxophonist, and but I've spent my life with a lot of folks that have experienced this firsthand. Thank you, sir.
Good. Should have brought the saxophone. Okay, let's
Would it
move on
compel
to
you?
we're going to move on to the guy with the best tie in the room. Welcome to Labor and Health Committee. Is this your first time in a committee?
Yeah, it is.
Well, welcome. That's the hardest part, is getting that green light to come on. Go ahead and just tell us your name and tell us what's on your mind.
Thank you, Chairman. My name is Chris Folsom. I'm a graduate student at University of Wyoming, and I've also graduated from University of Wyoming with a physiology degree. And I've also done physician shadowing under doctors who provide gender affirming care. That wasn't in Wyoming, but in Colorado. And I just want to say that I want to speak specifically to puberty blockers, because that's the only thing I've personally seen prescribed to minors in these situations. And just that I firmly support the use of puberty blockers for minors. I've seen it save lives. And I think in a state with one of the highest suicide rates, it's something that should really matter to us. And puberty blockers, the chief form of gender affirming care provided to minors, has been in use for decades in a variety of contexts, precocial puberty, certain cancer patients that many other people have testified to, and it has been proven safe. I can't speak to every specific puberty blocker about new ones that have arisen, but there are ones that have been on the market for decades that have been studied and proven safe. And I would just like to say that I think the banning of puberty blockers, in particular for minors, goes against the advice of the American Medical Association, the American Psychiatric Association, and every other scientific body that I've personally read the opinions of on this matter. And I would just like to encourage legislators to just defer to those opinions of experts. And I believe that is the majority opinion of medical experts in the field. That's all I'd like to say. Thank you.
No, thank you. That was very good, Chris. We appreciate that testimony. Okay, any questions, Senator Hutchins?
Yeah, I just want to say to you, Chris, thank you for coming up and giving your testimony as well. I know it's so hard. I saw you swallowing and it's like, oh, I know what he's going through. Chris, how old are you?
I'm 25.
Thank you, Chris.
He looks young for his age. People tell me that all the time. Yeah, thank you very much, Chris. Okay, let's go next. Pam, you're up. You're up.
Chair, committee, my name is Marcy Kindred and I'm a voter here in Cheyenne. I'm here today as a parent, not the parent of a transgender child that I know of. So I won't speak to that experience other than that transgender children and the parents who love them need acceptance and support, not criminalization. I will speak to something that gravely concerns me personally about this bill, and that is my parental rights. The choices we make as parents are always under scrutiny, right? It starts super young, like, are you breastfeeding or using a bottle? Co-sleeping or crying it out? Do you know the dangers of co-sleeping? We're all just doing our best, though. I co-slept with a couple of my kids, cried it out with 2 others, for the record, because each kid is different. Each have unique needs, and support looks different for each one. And in Wyoming, we value the right of parents to choose what's best for their kids. No one knows them better. This bill is not only a gross violation of that right, it not only strips parents of that choice, but criminalizes it. That's not the Wyoming I know and love. Wyoming parents are watching and following this bill and others. Even parents who do not have transgender children are concerned that this is the beginning of a very slippery slope
of government overreach into our homes and daily lives. The Wyoming I know is not into the government telling us how to raise our kids or live our lives. Transgender and gender questioning children and the parents that love them need less stigmatization and more support as they navigate how to best support and guide our youth to become the healthiest, happiest versions of themselves. And this is a huge step in the wrong direction. I'd stand for any questions.
Questions, committee? Senator Hutchins, thank you very much, by the way, for, go ahead, Senator Hutchins.
Yes, thank you, Mr. Chairman. Marcy, AKA Superloaf, thanks for coming again. I get where you're coming from, in a sense. You're right, you can sleep with your kids, you can feed them macaroni and cheese, all you want. You can do whatever you want, really. But when it comes to the life, liberty, and the pursuit of happiness of that child, us as a parent stepping in and doing something to them that may never, never, never be able to be reversed is serious. It's not like breastfeeding. You did or you didn't. Sleep with them, you did or you didn't. And this is why government is here, to step in and say, there are certain things we should not do. And this is one of those things we should not do, Marcy. Thank you. Would you agree, really?
Chairman.
Go ahead.
The argument being made against this gender affirming care is always under the assumption that people are just doing this willy-nilly. Like nobody's making this decision just on the fly because their kid saw a TikTok and that's just now how they want to. No, that's not what's happening. Like trust our parents, trust our physicians. That would be my answer to that. Does that answer your question? Senator Hutchins, through Chairman.
Quickly, Senator Hutchins, if you would. We're gonna run out of
I'll
time.
be quick. No, it doesn't, but that's okay. A quick question to you is, where did all this come from? I grew up as a tomboy and never had anybody say, well, let's affirm your thoughts of being a young boy or playing with trucks or climbing in trees or jumping off roofs or whatever. Scars all over my body from sword fights. But where is this whole idea coming from that we can change the gender of a child or any human being? If you can answer that.
Chairman Baldwin, I
Go
feel severely under. Like, I don't think I can answer that question other than transgender people have always been with us. We're just now recognizing and providing that support. And yes, so that would be my answer to that.
Okay, very good. Before we go to the next testimony, I just want to lay something out there for everybody. We just passed the halfway point. Actually, we're over the halfway point of this meeting. What we're going to do is after these two testimonies, we're going to reduce the time available because we've got 5 or 6 people online who want to testify. So after these two testimonies, we're going to cut it back to 2 minutes per testimony. So go ahead, sir.
Good morning, Chairman Baldwin, members of the committee. My name is Steve Milia. I have a master's in public health. I worked for the state of Wyoming for 20 years in the areas of sexuality and infectious diseases, and with the City of Houston Health Department, one of the 4th largest cities. I was a senior public health educator down there. I agree with this bill, and I think it's a huge step in the right direction as surgery is going way too far, especially with children. We've talked about gender affirming care. We should affirm the gender that they are, not that the one that they want to be. I would like to be Tom Brady, Tom Cruise, Arnold Schwarzenegger. My body is just not, that's just not the way it is. I have to accept that. I was not assigned a sex at birth. I was a sex at birth, and I'm still that same sex. And when I was, the reason I bring up Houston Health Department, because I was down there for 5 years and I did hundreds of presentations on sexually transmitted diseases, HIV/AIDS, and other health risks, and what the children, what the kids, the students in junior and senior high told me. You're the first adult that has come into this room and told us that we are not the problem, that the adults are the ones that have the sexual problems, that are trying to foist these things on us. And all we're interested in is growing up, and you are shoving this sex stuff down our throats. And so as I see all this transgender stuff, I feel great empathy for the young lady that was up here and all transgender kids. Not because, well, simply because I think there are a lot of adults out there, and if you want to, that are foisting a lot of false ideas on our children, and they are paying the consequences. I'll give you a specific Cheyenne example. Let's go down here to the Adam and Eve adult novelty and lingerie shop. You can walk in there. There's a sign on the door. You have to be 18 or older to go in there. They have some of the most depraved sex toys that you can buy in there. And we're the adults telling kids we know best. I invite you to go down there to the Adam and Eve shop, and there's another shop in town. And we sell, and only us adults can buy this stuff. We are so depraved and confused on our own sexuality. And we're trying to tell kids how to run their lives as far as they just want to grow up. And when I was in Houston, the kids told me the same exact thing. We're not interested in what you guys are telling us about sex. We are interested in it, but not like what you are. And so when it comes to this surgery, and you have young ladies having their breasts cut off, and the young boys having castrations, they want to do it after they're 18. When they're full adult, that's fine. But when they're kids, no, not at all. And when we say trust the doctors, well, my dad died because of some bad doctor advice. My sister-in-law was misdiagnosed, shouldn't have not have trusted the doctors. There are superb doctors out there. I go to the VA, best in the country. And there are some other doctors, I wouldn't go anywhere near them. So there's good and bad all the way through. We have to have discernment. And my discernment on this, have been a public health educator in different areas for 30 years, surgery is way over the line. Puberty blockers and whatnot, that's
If you can,
pretty
sir,
much
go ahead and
reversible.
wrap
So
it up
that's
if
it.
you would, please.
Pardon?
I was just asking you to go ahead and wrap up so we can get.
Oh,
moving
yeah,
ahead.
I'll just ramble on. So yeah, I'm finished. Thank you.
Okay, thank you very
Stand
much.
for questions.
Thank you very much. No questions. Next on down the line. Go ahead, introduce yourself. Go ahead.
Hello, my name is AJ Gold, and I want you guys to vote no on this bill. So gender affirming care can save lives and also create a positive impact for the LGBT community here in Wyoming. I believe if we are to truly call Wyoming the equality state, then we need to show that everyone has a right to their own healthcare needs. A family has a right to meet and come up with a plan for their child or patient about what is best for them. And if that means taking puberty blockers to slow down their development, they have a right to do that. That is between them and their doctors. Along with that, I would like to add that as far as I'm concerned, I don't know anybody under the age of 18 who has transitioned. There are a few cases, but they're not here in Wyoming. I do know quite a bit of transgender people. None of them have had any surgery whatsoever. They may be identifying as their preferred gender, but as far as I'm concerned, they haven't had any surgeries at all whatsoever. And personally, if I was a doctor, I would not want to come to Wyoming, especially if I'm going to be criminalized for doing what I believe is best for the patient, whether that's giving them puberty blockers or helping them transition fully. While I do understand there's concern from parents about, people not understanding the consequence of fully transitioning when you're not above the age of 18, that is not the government's concern. That is not your right to dictate whether or not a physician can give puberty blockers or help their patient transition into the gender that they prefer to be. So please vote no on this bill, and I encourage you and your colleagues to just see how harmful legislation like this is to people of my community. Thank you.
Thank you very much. Questions, committee? Seeing none. Okay. Committee, we've just entered the 2-minute drill for our committee. Ms. Semino, introduce yourself The clock is now running.
Oh, that's unfortunate. Mr. Chairman, members of the committee, my name is Lindsay Simino, and I do represent the Wyoming Counseling Association. We do stand in opposition to this bill. We echo many of the concerns that have already been expressed today. Part of my testimony was going to be expressing the very interesting Venn diagram that I live in, which is that though I do lobby for the Wyoming Counseling Association, I am also a mental health professional who is proficient in LGBTQ issues with adolescents. The majority of my caseload are kiddos who would express on some spectrum of the gender identity. And so I wanted to answer some questions and address some rhetoric that has been of concern. As far as the question of where did this come from, the trans health research that we have as far as adolescents really dates back to the 1980s. And so this is something that we have been studying for a few decades now. We recognize that gender dysphoria is a recognized diagnosis in the DSM, and we recognize that the best treatment for that is to have gender affirming care of some kind. We, again, I want to emphasize that these surgeries are not happening here. Puberty blockers is something that does occur. In my 10 years of practicing with this people group, minors within the LGBTQ community, I have never written a referral for puberty blockers or for hormones because we've been able to have these conversations outside or within our professional, using our professional expertise without having to be worried about being criminalized, without having to worry about, being accused of referring for surgery or our licenses being revoked. We've been able to have good conversations with parents and give them the education they need to make those decisions for those kiddos and slow that down. I know that you're getting ready to, that's awesome. And so we've been able to slow down that process by giving them the information without having to worry about our professional licenses being revoked. I'm just going to stop talking because I can keep going. So,
Questions, committee for Ms. Semino? Seeing none, thank you.
Thank you.
There's 4 empty chairs. Is anybody going to fill any of those chairs from here in the audience? Welcome, Deacon Lemon. And we're in our 2-minute drill. You hit that last time. You can go ahead, sir.
Thank you, Mr. Chairman, members of the committee. Mike Lehman, representing Catholic Diocese of Cheyenne. I listened to a little bit of the debate on the Senate floor yesterday. And for me, I guess the concern that starts to materialize is this notion that if you support legislation like this, and then there's suddenly a connection to the fact that you may be supporting childhood suicide or leading to that. And it's a very difficult thing. I don't think there's a more serious thing to be leveled at you. And I myself have experienced that just for raising questions on this very challenging subject. The only thing that I think would be more difficult would be to be a parent of a child who experiences this and to be told by somebody the very same thing. And what do you do when your child has suicide ideation, coupled with anxiety and depression? And I think we would be mistaken to not to not recognize the pressure that sometimes these parents are faced with, but also the providers. I don't want to in any way give the impression that, we have more than, who knows, maybe a handful of folks that might lead people down this path. But I have talked to providers themselves who feel some pressure. Having that same sort of connection level to them, would you not take steps that we believe will prevent suicide from happening? The truth is, a lot of these studies that have been done also admit, even the ones that speak for affirming care, say that there's no long-term studies. One of your colleagues on the floor mentioned Europe. I mean, this is different than many of the legislation pieces that you have to look at where you don't have the crystal ball. They've done it, and they have more than 1,000 families against who are suing the largest gender clinic in the UK because they were not given full information. With that, I would stand for any questions, Mr. Chairman.
Thank you very much. You're getting better at talking quick. Questions, committee? No questions. Thank you very much. Any further testimony before we go to online real quick? Going once. Senator McEwen. I believe you're a co-sponsor, is that correct? Okay. Okay, you got 2 minutes, sir.
Thank you, Mr. Chairman, and I will be quick.
Go ahead, tell us who you are.
I'm Senator McEwen, Senate District 24, Campbell County. This isn't about hating a community, to me anyway. This is about a permanent change to a child who probably is not old enough to make the decision. They're confused. And I hear we don't have that problem in Wyoming. Are we going to wait till we do and then address it? Because I believe we're headed there. And I'll leave you with one last thought. ARG. Thank you, Mr. Chairman.
Thank you. Questions for the senator? Seeing none?
Okay, I'll admit the first two.
Perfect. As always, you may have to tell us who they are. I haven't gotten good yet at reading sideways.
Mr. Chairman, I admitted Marcia Shaver and Laura Pearson.
I'll start.
Go ahead.
My
Introduce
name,
yourself.
my name is Marcy Shaver. I'm a mother living in Torrington, Wyoming, and friends with many trans people. In the last hearing on a similar bill, there was information bandied about that I double checked with this huge regret level of people who've transitioned. So I went looking for information. There is data on that. And it's not 40%, it is less than 1% ever demonstrate any regret. So I double checked with friends I had, and the answer was, I asked, have you ever regretted it? And the answer was a resounding never. Okay, so I asked if when you look for information that you go to reliable sources, the doctors and people that aggregate data, and not Google you, okay? That's just not your best source of information. I had another point, but I forgot what it was. Didn't write it down today. And I would like to know who is financing the young woman who's touring the country giving testimony at various legislatures, just personally. Okay. Any questions?
Questions from our committee? Seeing none, ma'am. Thank you.
Thank
for.
you, Mr. Chairman.
I believe Laura is next. Is that correct? Laura, if you could, there you are, Laura. Go ahead. Introduce yourself.
Thank you, Mr. Chairman and committee members. My name is Laura Tolliver Pearson. I'm a 6th-generation sheep rancher, wife, mother of 3, grandmother, small business owner, and school bus driver in Southwest Wyoming. I'm urging a vote of aye on this bill. Even if it's not here now, it will be if we don't do something. I can personally relate with this bill. Growing up, I always felt as though I was a male trapped in a female body, a tomboy. I loved doing what the boys did, playing football and other boy activities at recess, etc. I hardly ever wore dresses except when forced, usually Easter, when my mom handmade Easter dresses for us girls. People used to call me Sunny because I kept my hair short and looked like a boy. It wasn't until I went through puberty that I finally felt content with my sexuality. 3 children and 1 grandchild later, I am thankful that these types of issues were never considered when I was young. A child's mind and body need time to mature before these types of actions are considered. I fully understand that what these children are feeling, and my parents were always very supportive of the clothing I wanted to wear and the fact that many of my best friends were male. Never once was there ever any conversation about sex changes or puberty blockers. We need to be teaching children to love themselves in their purest form, instead of making them feel as though there is something wrong with them. So many times during this session, there's been testimony that there is an epidemic of mental health issues in our state. We are feeding the epidemic by validating that there is something wrong with these children that modern science can correct. We are playing God and we shouldn't be. Thank you for allowing me to testify.
Thank you for joining us again, Laura. Any questions, committee? Seeing none, thank you very much. We
Thank
have
you.
more people online.
Mr. Chairman, I admitted Sarah Bieber.
Okay. Sarah, can you hear us?
Can you hear me?
We can hear you. We can't see you, but go ahead.
I'm sorry, my internet is very slow. My camera freezes. My name is Sarah Bieber. I am a resident in Casper, a parent, a wife, a Christian. Just a couple points that I wanted to hit on. So it's not necessarily that we're worried about the Wyoming doctors that have been here. We're worried about the clinics and the physicians that are coming in from other states. Right here in Natrona, we have a proposed clinic that would offer gender affirming care, and it's out of Washington, DC. That's a concerning factor, as Washington has very open laws about doing these kinds of things to children. Another point that I'm sure you have heard and that I wanted to make again was there isn't another mental illness that, as medical professionals and counselors, that is affirmed. We don't affirm anorexia, we don't affirm bulimia, we don't affirm delusions, we don't affirm any of those things. So affirming care in itself is not necessarily something that all medical professionals and mental health professionals agree upon. As a nurse for the last 10 years and part of the medical field for the last 21 years here in Wyoming, I was taught in all of my 4 degrees in science of medicine that you don't give false hope. You don't tell people this one thing is going to fix all of the problems that you have. So doing that or presenting this as a way to help or fix all of the issues that children have or feel, to me, is false hope. The last point that I wanted to make, medical professionals, doctors, counselors, they all have multiple other ways to help children without delaying their normal, healthy progression and development. There are numerous other ways that we can help them. Puberty blockers, surgeries, all of those things don't have to be a part of it. We don't have to stop their normal progression to help them deal with the mental health issues, the
Sarah,
feeling.
you can go ahead and wrap it up here and make your final point.
Okay. That's all I have, really. Thank you so much for your time.
Questions, committee? Seeing none, thank you very much for coming, Sarah.
Mr. Chairman, I admitted Laura Pavey.
Okay. Laura, if you can hear us, go ahead.
Can you hear me?
We can hear you perfect. Go ahead, Laura.
Perfect. My name is Laura Pavey. I am from Sweetwater County. I'm a mother of 3. And I will not repeat what everybody else has been saying. I thought that I would share a little bit of other information. Thank you all for doing all this hard work. Additionally, there are tons of organizations out there that are LGBTQ related also that are against children using hormone blockers or having gender affirming surgery at a young age. Gays Against Groomers is just one of them. And when we talk about it's not here in Wyoming, it's like knowing that a storm is coming and not preparing for it. That's why this is such an important bill to pass on legislation right now. And we need to teach children that it's okay to be who they are in their own skin. And we need to end this crisis of teaching children that there is something wrong with them or something needs to be changed in them at such a young age when they're just figuring out and exploring all the beauties of life. Thank you.
Thank you, Laura. Any questions for Laura? Seeing none. I see another person on screen. Who are we looking at?
Mr. Chairman, I admitted Mike Tracy.
Mr. Tracy, go ahead. Dr. Tracy. We can't hear you, doctor. We can see you, but we don't do silent movies here. Still can't hear you.
Now can you hear me?
Yes, go ahead, doctor. Introduce.
Okay. Yeah, thanks, Mr. Chairman and members of the committee. My name is Mike Tracy. I've practiced internal medicine and pediatrics in Powell for the last 20 years. I'm a past president of the Wyoming Medical Society and the Wyoming chapter of the American Academy of Pediatrics. I feel like this is an important bill to discuss and for me to support because there are lifelong implications of the therapies being discussed in citizens less than 18 years of age. I want to just mention two terms, evidence-based medicine and medical reversal. Evidence-based medicine is a term that's often used, and what it really means is the care of patients using the best available research evidence to guide clinical decisions. And my role in that is to help patients and their parents decide how likely is someone to be helped and or harmed by our treatments. And in the hierarchy of evidence-based medicine, not all evidence is equal. So at the top of the pyramid, there are randomized controlled trials that start with a hypothesis and measure the effects. And this allows for calculations of numbers like the number needed to treat, the number needed to harm. At the bottom of the pyramid is expert opinion. This is the weakest, least scientific form of evidence. Experts may assume that the answer to a question is so obvious that studies are not needed. Expert opinion may also be subject to biases, groupthink, and other pressures, including politics. So regarding the gender-affirming hormone therapy in Senate File 144, the first puberty blockers, Leuprolide is the one that's being discussed mostly, and the AAP recognizes in their position statement on this issue that pubertal suppression is not without risk. These risks include bone density and emotional regulation concerns while on the medication. The second is testosterone. This is a Schedule III controlled substance. There's a gender-based discrepancy that's going to need to be addressed if this trend continues. And the third is estrogen. And I looked at the Cochrane Library, which is a collaborative based in the UK. It's an international collaborative that synthesizes the best available evidence. And on this topic 2 years ago, they said there's insufficient evidence to determine efficacy or safety, and that the lack of studies show a gap between current clinical practice and clinical research. And I think that's one of the things that is underlying today's discussion. So this introduces the concept of medical reversal. So there are many instances of doctors using medical practices, sometimes for decades, that are later shown to be of no benefit or even harmful once they're adequately studied. There has been a medical reversal of gender-affirming hormone and surgical therapy in Sweden. For much of the last decade, Sweden has been viewed as the leader in transgender care. In May 2021, it was announced that gender-affirming hormones and surgery will not be part of the standard care of transgender youth, except in a research setting approved by Sweden's Ethics Review Board. This does not mean that Swedish healthcare no longer cares for transgender youth. It means the risk of harm is being recognized and addressed through controlled study. So I hope these thoughts and comments are helpful for the important discussions and decisions to follow in the Wyoming legislature. It's not my intention to be so opinionated on this issue that I won't entertain discussion of people with other viewpoints, and I hope that we're civil enough that we can do that. Thank you for the opportunity.
Thank you. You read my mind. I was about to call your time limit, but you hit it perfect, Doctor. Any questions for Dr. Tracy, folks? Seeing none. Thank you very much for visiting with us, even if you didn't have travel. Okay.
You're welcome.
I believe there's one more. Let's take one more testimony and then we're going to move on.
Mr. Chairman, I admitted Cassie Craven.
Cassie, we see you. Go ahead and introduce yourself.
Thank you, Mr. Chairman and members of the committee. My name is Cassie Craven. I speak to you today only as a mother of a tomboy and a very girly girl, and also as an attorney. I have 2 points I'd like to make to the committee today. The first, on CNN last night, U.S. Surgeon General, Dr. Vivek Murthy, who was Surgeon General for both Barack Obama and for President Trump, brought up an interesting point. He said that the age at which social media should be allowed for youth should be 13, and that we should start entering into an era of standards of safety implementation for these youth. That the impact that social media is having on these kids is so dangerous and so confusing that it's changing the worldview and how we move about in it. I think that can't be lost on this committee today, because the whole goal of this bill, and I support it and speak in support of it, is to protect the life, liberty, and pursuit of happiness of these kids. As lawmakers, it's your charge to protect innocence and to sometimes make decisions for children that they can't make for themselves. The sentiments of children are just that. They're sentiments. We should not be indoctrinating them into self-denial. The second point I'd like to make is as an attorney. I think that this bill protects medical providers. The way that the statutes are currently written, if you look at the definition of mental injury of child abuse in the state of Wyoming, it means an injury to the psychological capacity or emotion stability of a child as evidenced by an observable or substantial impairment in his ability to function within a normal range. Moreover, this is designated as child abuse of emotional infliction in our current statutes. And I'd also refer you to look at the intent provisions. Child abuse in the state of Wyoming is not a specific intent crime, it's a general intent crime. I think that the way that the law sits now and allowing for this without a clear cut and dry policy position puts providers at risk to criminal liability and moreover to civil liability. Thank you, and I'd stand for any questions.
I want you to know that you're the very first one that hit the 2-minute mark right on the nose.
Thank you, Mr. Chairman.
Thank you very much, Ms. Craven. Any questions, committee? Seeing none, we're going to go ahead and close public testimony. There was nobody else online, is that correct?
There is one other person online with their hand up. Daniel Weiss.
Yeah, since there's just one, let's go ahead and bring him in. Are you there? There he is. Go ahead, sir. Introduce yourself and speak.
Yes. Hi. Yes, my name is Dr. Daniel Weiss. I'm a board-certified internist and endocrinologist. I'm also a senior fellow with the nonprofit organization called Do No Harm. My commentary is mine alone and does not represent the views of any medical practice. I have provided hormonal treatment for persons with gender dysphoria in the past. I do not do so now. There is no good scientific or clinical evidence to support hormonal or surgical interventions for minors with gender dysphoria. Instead, there is increasing evidence to show that such treatments for gender dysphoria cause harm. I encourage you to look at the references I've provided. A paper published last year in the Endocrine Society's key journal summarized the evidence on hormonal interventions for gender diverse adolescents as sparse and of low quality. And gender dysphoria resolves in the vast majority of children without any interventions. So what about harm? Many studies show that the puberty blockers and opposite sex hormones damage bone health, cardiovascular health, and fertility. There is emerging evidence of increased rates of breast cancer and other adverse effects. Those who state that puberty blockers are readily reversible and harmlessly pause puberty can cite absolutely no published data on the reversibility of these drugs in this setting. The FDA has not approved any drug for treatment of gender dysphoria. The best data suggests that hormonal and surgical interventions increase the risk of suicide. In fact, a long-term study in Sweden showed a 19-fold higher suicide rate, 40-fold higher in females, and a 3-fold higher mortality rate despite treatment with opposite sex hormones and surgery as compared to the control population. A study published just last month in the New England Journal found a 45-fold higher suicide rate in youth who were treated with gender affirming care. That was on treatment in gender clinics in the United States.
I'm going to ask you to.
And just to wrap up, I remind you that Finland, Sweden, France, and the UK have discouraged or terminated opposite sex treatment for minors. Instead, they advise supportive psychotherapy for minors with gender confusion. And we need to move towards that direction also and protect the children of Wyoming. Thank you.
Thank you much, Dr. Weiss. Any questions for Dr. Weiss, committee? Seeing none, we're going to go ahead and close public testimony and work this bill. Committee, what's your pleasure? Moved by Senator Hutchings. Okay, let's go through the bill. I know there's a couple of amendments. Let's just go page by page. If you got an amendment, jump in. Anything on page 1? Page 2. Page 3. Page 4, Senator Bouchard, I believe, has one.
Mr. Chairman, I mean, I don't have the actual language, but can we do a conceptual amendment to including the CPP, so Central Precocious Puberty? I don't know if that's syndrome or, but, so that's why I want to say, can we do a conceptual amendment and then get it drafted?
Let's do that as a committee of whole, if that's okay with you. And they'll give you some time and you can get the correct language, get with LSO, get with that.
Okay, appreciate that, Mr. Chairman.
Okay. Anything else on page 4? Page 5? Go ahead, sir.
Mr. Chairman, Mr. Chairman, we've been provided a amendment. It's in a proposed amendment form by our LSO. Senator Bouchard gave it. I'll just move that amendment. I think it's appropriate to include the entirety of the healthcare providers that have prescriptive authority. And this brings a provider that was inadvertently left out of the bill. I think, good Senator, while it's his amendment, I certainly think it is appropriate to have in the bill. So I would move that.
So moved. Any questions on the amendment or its intent? I think it's pretty straightforward. It just includes those prescribers that were inadvertently left off. Okay, you've heard the motion. All in favor of that amendment, please say aye.
Aye.
Any opposed, say no. That amendment has passed. Senator Barrow.
Mr. Chairman, I probably should have did a little more explanation for the public on that. What it brought in was the advanced practice registered nurses into the bill. Right now, it only dealt with physicians, and since APRNs also have prescriptive authority, it brought them into considered in the bill in the same way. So I apologize that I didn't actually explain the amendment, even though it wasn't even my amendment, but trying to move things.
You did very well. That was a good explanation.
Mr. Chairman, just to clarify what we thought when we did the bill, we thought we had it in when healthcare providers. And as you know, we've been visiting this all the time, trying to fix that language all throughout our throughout our code. So anyway, good amendment.
Right, we caught that amendment in the first part, but not the second part, but now we did. Okay, very good. Anything else? Moving on to page 6. Page 7. Page 200. Hearing none. Any further discussion on the bill? Comments, questions, suggestions? Senator Barrow.
Thank you, Mr. Chairman. So, Mr. Chairman, as we know, we had a different bill that addressed a much broader look at this issue, in my view. And I voted against it because I felt we did not know the consequences of that. This bill, I find to be very precise. And I understand there's folks out there, and I've heard the testimony, and I've interacted with some of you that believe this bill goes beyond what it is. I believe this bill, if you look on page 3, line 16, for purposes of transitioning a child's biologic sex. And then it lists very specifically. So while I understand, I don't even know that the language for the puberty blockers is necessary, because I don't think that's about transitioning a child's sex. It's for other purposes. I am far more comfortable with this than the previous bill, and will vote accordingly. Thank you, Mr. Chairman.
Further comments, committee? Senator Bouchard, I forgot your name there for a minute. Go ahead.
Mr. Chairman, speaking to the young ladies that have, I mean, one of them, her name's on the bill, to add to Senator Barlow's comments, we had discussion about that other bill, and they certainly don't want to criminalize their parents because they were brought into the tornado, some from outside influence. And so they're not the criminals here. And so I do want to add that even though I did vote for that bill, I was looking for some type of reducing those or trying to make sure that we didn't criminalize parents that were in the middle of that tornado. So I don't know why I'm rambling on about that, but hopefully I hope everybody understands my sentiment here, that in agreement with Senator Barlow, understanding where his vote was on that other bill. And I think this bill solves that problem, gets us in the right direction. And again, that's Chloe is on this bill, and We had testimony this morning. I'm sure in the same agreement here. We don't want to criminalize the parents of these children that are wrapped up in this. So thank you.
And I will tell you, that's the first time I've ever heard you ramble, but thank you, Senator Bouchard. So before we go to vote, I would first of all like to thank everyone in the room and online. The decorum was very well. It went very well. The respect we've shown for each other was very good, and I appreciate that. I always appreciate that in this committee. It's not always an easy thing to do in this committee, as everyone that's been here very much knows. But I appreciate what I've seen here today, and I appreciate the testimony. People who came from distances, people who didn't travel anywhere but talked to us online. I appreciate that. So know that. With that, I believe we'll go ahead and take the vote.
Thank you, Mr. Chairman. Senate File 144, Chloe's Law, Senator Barlow. Senator Bouchard. Senator Dockstader. Senator Hutchings.
Aye.
And Chairman Baldwin. We have
Excuse me, Chairman Baldwin.
Senate File 144 has passed the committee, and I see the sponsor of the bill who's second on our agenda. He stood very patiently back there, and I apologize greatly, Senator, but it's 9:26 and we'll be gaveling in 4 minutes. So with that, we're going to go ahead and close this. Thank you very much. My mic is on.
Can I have privileges for a second?
You may, go ahead.
There was a question by someone on about who financed the travel, and I just, it's going to come out. I want to say it here. That person has attacked me a lot on social media, and Senator Larson, Senator McEwen, and myself, we formed an outside entity called the Senate Conservative Leadership Caucus. We raised money, and we help, and we want to continue to help make sure there's testimony to make sure this bill advances.
Very good. It's out there now.
Thank you.
Senator Hutchins, don't, go ahead.
Somebody in the room, their phone went off and they know who they are.
Donuts.
I
Okay.
like.
Rat
I
'em out.
like
Who was it?
Dunkin' Donuts, coconut. So whoever you were,
I don't want it,
bring it in.
We prefer chocolate glazed or maple glazed.
Just bring them in.
Okay. Bring them to me in the hall and we'll take care of that. Okay. Committee is done for the day. Thank you.